Some good news on the local front, some not so good news in regards to the Moderna vaccine, but a lot to work through and to sift through here. Joining us to do that, I've got Dr. Raywat Deonandan, an epidemiologist and science communicator at the University of Ottawa. Welcome back.
Thank you.
Why don't we start with the good news locally, shall we? A little bright spot on a Friday, and it feels like Ottawa once again is responding to the different health measures that have gone into effect because our rate of infection is now going down. It's 44 per 100,000 for the positivity rate, for the number of cases, and the positivity rate has gone down to 2.6%. So let's do a bit of a temperature check. How do you think we're doing right now?
Oh, we're doing so well. I'm so pleased with Ottawa. Those are just the right indicators we care about. So we're on track. Of course, I'll be that guy who says we still have plateaued in the wrong level. Need to drive down a bit more, and the threat of the new variants is still present. But we seem to be responding the way we should.
And the same thing goes for our wastewater surveillance. What do you make of the latest data there?
It's going down, absolutely. So that's the objective measure. No testing biases there. So the presence of the virus is diminishing in our community without question. It can go up again if we relax things too quickly and too vociferously, and if we allow incoming travelers with the new variant to seed our population. But otherwise, things are going the right way.
What do you think about some of the decisions that have been made locally, like shutting down the tobogganing and sledding at Mooney's Bay, but allowing the Rideau Canal Skateway to open only to people that live nearby?
That's just weird to me. So I think we should be encouraging outdoor education, outdoor recreation as much as we can for a number of reasons. It's largely safe, with some exceptions that are behavior-based, and it can really help assuage some of the mental health concerns being cooped up so long. I understand not allowing travelers to come from far to come skate, because then you're really encouraging a lot of domestic travel, intercity travel. We don't want that. We can discourage that. We want people who live elsewhere in the city to come use the canal. That's not a bad thing. And we want people to be outside enjoying the fresh air and the sunlight and not being cooped up. So I think whatever advantages we get in terms of diminished transmission probably aren't worth the pain we get from prohibiting people from doing these largely safe activities.
So far, the Skateway has been pretty quiet, but it opened on a Thursday and now it's a Friday, so people should be at work and the kids should be doing virtual schooling right now. I'm wondering, do you think the polite ask will be effective for the canal on weekends, on a Saturday or Sunday?
Ooh, that's a tough one, because as you know, that gets really crowded, typically on a good winter when the pandemic isn't present. I think it might be respected because people are afraid of large crowds, as they should be. So I think it will be slightly diminished. Also, it's really cold these days, so I'm hopeful.
Wait, are you saying you don't like to skate in minus 21, Dr. Deonandan? That's not your ideal skating weather?
I was born in the Caribbean. This is all alien to me.
Well, hopefully it doesn't get too crowded tomorrow. I guess we'll have to wait and see. Meantime, zooming out a little further, today we got some news from the federal government that unfortunately Moderna is cutting its deliveries to Canada. So we're going to get 20 to 25% less product. We knew that there would be hurdles. Here's another one. Coupled with the news about Pfizer, how significant do you think this will be for the impact and our delivery, basically, the speed of our delivery here in Ontario and in Ottawa?
It's impossible to tell, obviously, but this is not good news. And I'm getting really concerned with our ability to persevere through more of these mitigation strategies deeper into the winter, the summer, and possibly fall. We were given a date of around end of September for when the majority of the Canadian population would be inoculated. And if we don't meet that, there's going to be a lot of discontent. What I'm hoping happens is that there is a national emergency perceived, if not declared, where we pull out all the stops. We allow for negotiations with other drug companies to lend their manufacturing capacity to Pfizer and Moderna if possible, or at least their packaging capacity. We start looking at domestic manufacturing, whatever it needs to be. And hopefully the other vaccinations, formulations like Janssen and AstraZeneca start being okayed here, because we need to fill those gaps pretty soon.
The government is now introducing mandatory PCR testing at airports for people returning to our country. That's on top of the pre-boarding test that's already required. And people will have to stay in a quarantine hotel for 3 days when they come home at their own cost. Plus, now Canadian airlines have suspended flights to sun destinations. What's your reaction to that new strategy?
Yes, I'm for it. there should not be recreational travel right now. There should be travel that's essential travel, or travel that you need to see a loved one because you're sick or something, absolutely. But these vacations to hotspots are not helping. The pushback will be that only 2% of transmission is caused by international travel. But as I always say, 2% of a large number is a large number. And there's a very large proportion of cases that are not contact traced, and that could be due to travel as well. In this environment of these new variants that are threatening our very existence in many ways, we don't want to risk reinfection or seeding events being imported from other countries. It's just not worth the risk. So we have to do whatever we can to discourage that from happening. The PCR test, sure, why not? Quarantine hotels, that's great. But as we saw in some other countries, outbreaks can happen in quarantine hotels. So it matters how this stuff is managed. I'm hoping there's sufficient oversight.
I find it a bit funny when people say only a small percent of these cases are coming from travel. Now, I understand what they're saying when they're saying, look at the data and the number that are coming in. But I mean, this pandemic, all of these cases came in from travel. That's how
Exactly.
it started.
100% of COVID cases around the world, except for some of them in Wuhan, China, were caused by travel. Yes.
Right. And okay, I know I'm being a bit silly here, but that is how this pandemic started, and that is how the variant got in. And on a more serious note, that is how the variant got in to the home in Barrie. It got into the home and it killed a bunch of the residents there, and it infected almost everyone. The variant came in through travel. So I don't think that we can just walk away, throw our hands up and say, yeah, travel isn't actually that important. It is still important.
Look, I get a lot of angry mail whenever I make a comment on the air of anything regarding this pandemic. What got me the worst and the most angry mail was when I said there should not be recreational travel to vacation spots right now. Apparently, there's a strong contingent of Canadians who feel it is their very mortal right to travel during a pandemic for vacation purposes. I don't understand the mindset. We're in a race here against the invasion of these new variants. It's almost an existential threat. I won't go that far, but it's fun to say that. It's just we have to race against the rising dominance of those variants so that we can vaccinate the hardened population in time. We're losing that race. So any advantage we get in getting ahead of that eventuality is useful. Now, that means banning travel, and so be it.
Just on the new modeling that came out from the province yesterday and the factor that they were looking at with the UK variant, they said we're in better shape now than we were 2 weeks ago, but we've got to hold steady to prevent the new variants from spreading. And then they went on to say that it's possible that the UK variant becomes the dominant strain by the end of March. What would that look like when they say it would become the dominant strain?
It would mean that transmission is more likely across the board. It would mean the base reproduction number is higher. It would mean that the margin of error for the failure of our mitigation strategies got much, much smaller, by which I mean you can't screw up with your mask wearing as often as we currently do. It means we can't allow the number of people gathering to be higher. It means we really probably have to prolong the closures of some things longer too. So it's just that the stakes get higher, and so our ability to soften the measures is diminished as well. It also means possibly the epidemic curve looks a little more peaky, So more cases will occur, and with more cases, possibly and probably more hospitalizations. Maybe not more deaths if we get vaccination into the appropriate arms in time.
I was going to say, what do you think we can learn when we look at places like the UK that have seen the variant? What do you think we can take away from these other countries after watching them deal with it?
Well, I look at the UK, France, Portugal, Switzerland. I'm going to say something really controversial, but their school openings have been fraught with outbreaks of the new variant in schools. So that's something we have to watch as our schools start to open too. So people there didn't take the new variant as seriously as they could. The UK, a friend of mine who lives there calls it Plague Island. The compliance with public health guidance is not great. Ours is much better. They're really struggling under the burden of this disease. On the other hand, they have the great advantage of many more vaccines available, and they have rapid testing for their healthcare workers. So they seem to have more tools on the table to play with, even though they have a greater disease burden. So the comparison is not accurate, unfortunately. But the threat is real. These new variants can cause chaos if we don't get ahead of them in terms of vaccination and mitigation.
But when it comes to schools, is it that there's a high spread in the community and then the variant is in schools and it's just a mirror of that? Or is it that you believe schools are helping to drive the spread of the virus?
It's a very controversial question.
Is it like looking in a mirror, or is it behind the
Yeah.
steering wheel and it's driving the thing?
So most definitely, the schools reflect the caseload in the community. Most definitely, the safest way to open schools is when the caseload in the community is low. The big question is: are schools also accelerators of the pandemic? And that's a controversial question. I don't really know the answer to that. I suspect they probably are. And that's why, as we open up, I'm hoping that we add some surveillance tools, like some, rapid testing and a variety of schools, just to make sure that's not happening. Because I want schools open as well, but I want them open in a strategic way that keeps them open safely and doesn't add to the burden in the community. And it's just that our data doesn't really tell us. Our contact tracing data is not set up to identify if, in fact, schools are contributing. And if you asked 10 experts, 5 will say they do, and 5 will say they don't. So, unfortunately, there's a lot of division here.
Let's talk about the Johnson & Johnson vaccine. I think this is the one a lot of people were excited about because they said, hey, that's the one I want. That's the one-shot deal. Single shot only, good to go. But then we find out after this clinical trial that the vaccine is 66% effective at preventing moderate to severe illness. That number jumps up to 85% in the level of protection it offers against the most serious symptoms. What do you think of that?
When this whole ordeal began and the vaccines were being touted as possible saviors, we set the threshold at 50% as something that's acceptable. If we had a vaccine that's 50% efficacious, that would be a game changer. Then we got Pfizer and Moderna giving us 95%, and we got spoiled by that number. 95% is extraordinary. The fact that we have one now that is not quite as high as that, but is still healthy at over 60%, is still a good tool. Now, it matters that it's a one dose. It matters that it's a viral vector technology, meaning we can probably store it close to freezing. It doesn't have to be the cold chain storage that Pfizer has to have. So it makes distribution easier. So this is going to be an important tool at a global level and possibly at the Canadian level too, because of those advantages. It doesn't matter if it's not as efficacious if not as many people can get it, right? So these are sort of competing factors in describing the characteristics of the vaccine. We need as many tools as we can, and now we have another one, hopefully, that we can deploy.
Dr. Raywat Deonandan, always a pleasure getting your perspective on the show. Thanks so much.
Thank you.